Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in both healthcare and public health, I understand the challenges and opportunities that come with bridging multiple disciplines. If you are an interdisciplinary professional, a high-functioning leader with expertise across different fields, then you know what it's like to see opportunities that others often miss. You also understand the gaps in our current systems, and you have some great ideas about how to make things better. But sometimes having a unique perspective can feel a little isolating or frustrating, especially when it feels like those around you aren't as excited or as open to your ideas. Does any of this resonate with you? I'm speaking to you. You may even find that you feel a bit divided across the different disciplines or fields of expertise. Well, I definitely understand, and it is also why we've focused this podcast to provide you with the type of support that you need. On this episode, I want to share with you a bit about the discovery call. A lot of you face challenges with the discovery call, and let me define it first. What I'm calling the discovery call is that initial conversation you have with a prospect, someone who could become a client, a paying client in your business. They come up to you because they have a question, a problem. They want you to help them. They're looking for some sort of solution, an answer, a fix for the issue, the problem that they have. And during that initial meeting that you set up with them, they start to tell you all the problems, what they need, what's broken, what's not working. And because you have such a wide range of expertise, often this interdisciplinary professional especially, you have so many solutions and skill sets, and you could easily answer that problem. So on that discovery call, what I find is that a lot of entrepreneurs are solving problems and getting really deep in the weeds with prospects at this point. And when they come to me, they're usually saying things like, people just don't want to pay for my services. People only want free things from me. I'm having meetings with people and they never want to pay me for my services. And I've found that's usually because of that discovery call issue. You go right into problem solving and wanting to give them all the solutions. And what you're doing is you're training people to take all these things from you for free. You're teaching them that this is what you're providing and you're not charging for that. Or you leave them with all the solution and there's nothing for them to pay for because you've already given it to them for free. So what I encourage you to do is, first of all, assess, is that your problem? Are you feeling like people come to you, talk to you all the time, but they never want they don't want to pay for anything that you're offering. They just want free from you. And if that's you, I'm not beating you up or picking on you. If anything, I want you to know that you're not alone. This happens a lot because we have generous hearts. We want to help. And that's often why we're in this space of public health and healthcare and so forth. But I want you to reframe or restructure how to deliver your discovery calls. So instead of solving all the problems and jumping right into that, I want you to step back a few paces and define your discovery call. And you may be calling it something else, another word for it, but often it's a discovery call. And think about the sheer meaning. It's a discovery call. You're supposed to discover and explore. It should have a purpose of being able to determine a good fit, a good mutual fit, really. So that person has got this problem and they want to know if you're able to solve it. And you want to hear their problem because you want to know if you're able to solve it. Is your solution a good fit for their problem? Is this a client that you want to work with? And if you're able to help them. So when they're coming to you, if you think about it, sometimes it's helpful for us to assess this if we do a medical field analogy. If you need to have surgery and maybe your gallbladder needs to be removed, the first time you visit a surgeon, it's a consultation. They want to go over everything that they have been sent in terms of records. They want to meet with you, ask you questions, do an assessment, make sure that all the boxes are checked. And yes, indeed, this is a good patient for me, and I am the right person to help this patient. And the patient is getting to meet this doctor who's going to perform the surgery and make sure of get all the questions answered, know exactly what to expect, eating the night before, make sure you have this and that ready, have someone to bring you. You're going to be off work for a certain period of time. What are the expectations for recovery? Like all of that is discussed in that in that consultation when you're referred to that surgeon. And then the next appointment, of course, you agree, yes, they're going to do the surgery. You probably sign some documentation. And then the surgery is scheduled for a time in the future. It could be the next day or the next week. Now, back to our example here at our situation as consultants, we want to have this discovery call. We want to assess the situation, see what we're working with, what we're dealing with, hear from this prospect, and then they hear from you. And then you're able to, now that you have all the pieces together, even if like at the time that they're going through all this, that you can, yes, I can do that. And yes, you probably have figured out what to do, but you're not delivering that on that call. You're gathering the pieces together so that you go back afterwards, you plug it into your proposal and you draft out an estimate for the cost of working together and for you delivering, and you list out all the pieces of that. And then you come back together with that prospect and then you present them with your proposal. Yes, I can solve the problem. And what I heard was this. And yes, we can do this. And this is going to happen. This is going to happen. This is going to happen. And this is your investment. And you give all the details, and then they get to decide, okay, yes, this is perfect. This is what I'm looking for. And they accept your offer. You agree to whatever, you set the terms of payment, if it's all at once or whatever the payment terms are, and then you start the work, just like in that surgery example. I hope that you're understanding what I'm explaining in very simple terms. When we're in our mastermind group program, these are the types of things that we dive into more deeply, and I can give you more specific guidance based on your business and what your services or products or offers are. But we did do quite a bit of this in our recent mastermind retreat in terms of helping someone kind of reframe this and move into a situation where they were having a much better discovery call process. So there's a second part of this that I will add on here, and that is making sure that the people who actually make it to your discovery call are qualified to be in that seat. In other words, you want to make sure that the people that you're taking time to meet with on a discovery call are good prospects, are good potential, the types of people that fit the profile of your ideal client. That's something that we also work on, but that's important so that you're not having a discovery call. Maybe you have 3 of them on your calendar and you're excited to meet with 3 prospects and talk about the opportunity to have 3 new clients. And then you find out the 2 of the 3 are not even qualified, could never be a potential client, but they made it to that space. And you've now wasted your time, and it's a waste of their time because it's not a fit even to be in that space. So there are things you can do to make sure that you're getting qualified people to that seat. And those are also things that we dive into in our mastermind group program more deeply. But as you're listening to this, just think about what you can do to pre-qualify people before they even get to your actual discovery call appointment. Sometimes people have a link on their website for people to opt in and schedule, but maybe you insert something before that, a questionnaire that helps they answer questions and you get back to them to schedule. So therefore you can kind of weed out who are the right fits to then be in your discovery call, to meet with you for discovery call. So all of these things help you make better use of your time and have a much better experience on the discovery call itself, so that you're moving the right people, the right prospects into opportunities to be your clients. And it's also a great experience for the people who meet with you to know that, yes, indeed, you can help them with their challenge or problem, or maybe that, no, you're not the right fit. So I hope this is helpful for you. As we begin to wrap this up, I'd like to remind you that there are 2 ways to support you, that I can support you on this public health entrepreneurial journey. If you're looking for personalized guidance, let's work together one-on-one. As someone who understands the unique challenges of being interdisciplinary leader, I can help you turn your innovative ideas into reality, help you more specifically on some of the things that we talked about in this episode. If you'd like to have that one-on-one feedback and guidance to crafting, maybe you want to make sure that you're putting that system in place to qualify people to then get to your discovery call and then having a better discovery call itself. Or if you're ready to join a community of high functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who, like you, are bridging multiple disciplines and creating meaningful change in public health. Visit publichealthentrepreneurs.com. The link is also provided in the show notes. All right, everyone. Until next time, have a fantastic rest of your day.